Hi, in this video I'm going to explain about tests that are conducted for diagnosing food allergies and what they mean. To confirm that a true food allergy exists and to avoid unneeded food restrictions, it is preferable to have a consultation with an allergist who is a doctor specializing in the treatment of allergies. There are several types of tests available. Let's understand them one by one. The first one is the Ige test. Now, when the likelihood of a food allergy is high, an Ige food allergen test is indicated. A positive test primarily points out to sensitization, which is the initial exposure to the allergen, but may not confirm the allergy. The concentration of Ige also does not correlate well with the severity. A physician-supervised oral food challenge may be required for diagnosis. It is not affected by medications such as antihistamines. The second one is the food skin prick test. Skin puncture tests are the most common screening test for food allergies and can even be performed on infants in the first few months of life. The larger the skin test wheal size, the more likely that a clinical allergy exists, but again, it does not determine the severity. A negative food prick test generally has a very high predictive value, which means that there is a low chance of a true type 1 food allergy. Positive results, in addition to the patient's history, must often be confirmed by an oral food challenge unless the patient has a definite and convincing history of a significant food allergy. The third one is the serum measurements of eosinophils or the total Ige concentrations. Abnormal results from these tests do not identify or confirm the diagnosis of food allergy. Likewise, normal values do not exclude diagnosis. And the fourth is the food diary. Now, this consists of keeping a chronological record of all foods eaten and the adverse symptoms. It is an inexpensive method that documents the frequency of symptoms and their occurrence in relationship to specific foods. In addition, it encourages the patient to focus on his or her diet. This record is helpful for identifying problem foods, but again, it is not completely diagnostic, especially when symptoms are delayed or infrequent. Review of the diet diary can reveal that the patient is not experiencing a reaction when eating a food to which he or she was thought to be allergic. This certainly provides good data for your doctor during the evaluation. You can note down points in your diary such as what was the timing of the reaction in relation to the food intake. What are the types of symptoms? So, for example, headache, joint pain and brain fog are not common symptoms of food allergy, whereas mouth and throat itchiness, hives and wheezing are. Did it respond to medication? Have symptoms been consistently reproduced by the suspect food? Were there any new foods introduced into the diet? Although new foods could be likely culprits, it's not always the case. Did the patient take aspirin or a non-steroidal anti-inflammatory drug, consume alcohol or exercise before or after the reaction? These factors may increase the likelihood or severity of an allergic reaction. Watch part 3 to understand more about food challenges and the treatment of food allergies. Hope you found this information helpful. If you like this video, please like, comment and share. You may also subscribe to the channel and hit the bell icon for more updates.